Hi, welcome to Healthy Living. My name is Amy Bouton with St. Tammany Health System, and today's Healthy Living, we're focusing on back to school since we're right around the corner from back to school. And we have 3 guests that are going to join us today to talk about some important things for parents and children to know when their kids do return to school and before they return to school. So my first guest is Dr. Russell Reed. Dr. Reed is an interventional cardiologist who practices at our St. Tammany Health System Cardiovascular Clinic. We have 2 locations, which we'll talk about later in the segment, but thanks so much for joining me today, Dr. Reed.
Well, thank you for having me.
Yeah, it's great to have you here. Can you tell folks a little bit about yourself, about what you do, and a little bit about your care philosophy?
Okay. Well, I was born and raised in Mississippi and actually practiced on the Gulf Coast for 4 years before moving here, and I'm going into my 5th year here now.
Oh, good.
But I'm trained in interventional cardiology, so I mostly do balloons and stents and those type of procedures, but practice general cardiology as well. And as far as just philosophically what I do and what I've always tried to do is treat every patient like they're a family member. Every person I see, I treat them like they're my parents, treat them like they're my children, and so that's why going back to school and what we're about to talk about as far as sports screening is important, because I have 3 children, 2 of which are teenagers, so it hits close to home there.
Yeah. So, and I'm glad that you talked about what we're going to talk about, because we know that children, when they go back to school, there's a lot of adolescent athletics that children can join, boys and girls, and they do sports physicals. Most are required to get a sports physical, but to get a little further into protecting their health, we do offer something through our outpatient pavilion at St. Tammany Health System, and you read the results of those things. It's called the Living for Burke screening, and this was brought on because we got into a partnership with a local family who started a foundation called Living for Burke when their teenage nephew died of sudden cardiac arrest after football practice during a pickup basketball game many years ago. And so they started a foundation, and the Living for Burke screening involves an EKG and an echocardiogram. And so the young man, it was determined, died of sudden cardiac arrest, and so therefore this is what came out of it. So let's talk about that, about how this helps to determine the heart health. What is the importance of the EKG and the echo?
Well, it's really a good screening because, and a lot of, going back just a little bit before the testing, it really starts with just talking. And the American Heart Association has a 14-point assessment where it's really delving into symptoms, history, personal history, family history that could signal that there could be an underlying cardiac issue. So where the EKG comes in is it just gives you a baseline tracing of, can give you an idea of any structural heart problems and also any arrhythmias, because those are 2 things that we really worry about or can be causes of sudden cardiac death in anyone, but especially young youth and children.
Right.
From the EKG, then the next step will be an echocardiogram, and that's where we can actually look at the heart, we look how it beats, we look at the valves, and so that gives us an idea if there are any structural abnormalities.
Right.
Anything that we need to do, any further testing from there.
So parents, why would you recommend this for parents, or why would a parent opt to do this, especially if their child is a student athlete?
Well, every student athlete starting from age 12 needs to have some type of screening. Now, not everyone has to have, an EKG and echocardiogram.
Right.
But certainly red flags, whether it's symptoms, but most importantly, if there's any sort of family history. If you have a family member, whether it's a parent, whether it's a cousin, someone who suffered some sort of adverse cardiac event, sudden cardiac death, where you want to make sure that there's no genetic problem that you could have that too. Those are the ones that I would certainly recommend have screening.
And once, like you went over this a little bit, but once the screening is done, there are factors when you read those test results that can give you an idea of maybe something is going on, or we could look into it further, or if there is some sort of abnormality that needs to be looked into deeply.
Right, correct. Because, especially with the echocardiogram, one of the things that we worry about, and one of the factors that we've seen in sudden cardiac death in athletes is hypertrophic cardiomyopathy, which is you have signals on EKG that can suggest that, but the echocardiogram you can really see it. So that way you can start testing there, and you don't push that child into athletics and put them at risk.
So aside from, like you said, family history, or someone had an event or something like that, what is something that parents should look for as far as, are there signs and symptoms of something that would lead up to a cardiac event?
Well, probably the main ones you worry about are if your child starts experiencing some shortness of breath, and not the shortness of breath because they're out there in the heat and they're tired, but something that's out of the ordinary. If they start having any sort of chest pain, or if they, and probably one of the biggest concerns is if they start passing out.
Okay, so that's good to know. So if something is discovered during the screening, what happens next? What's the next steps?
So if something is abnormal on the screening, then the next step is really for them to probably do further testing, whether it's we have all kinds of newer cardiac testing, whether it's MRI, but probably get in to see a pediatric cardiologist to really look into exactly what's going on. And sometimes it involves more genetic testing, and we have different subspecialties of cardiology that they may need to go and see some of those physicians to make sure that we know what we're dealing with, and also it gets adequately treated.
Okay, that's good to know. So let's talk about the fact that it is hot outside. How does the heat factor into heart health for children and adults? Because they have these practices during the week, or during the summer, and it's really hot outside, and a lot of these kids are wearing a lot of equipment. How does the heat affect the heart health, and how do we keep our hearts healthy when we're under this kind of stress?
Yeah, this heat, you said the word, it's stress. When it's this hot, every time you go outside is a stress test. So when you're practicing the heat, it's hard on your body, and that's where everyone, the athlete, the parent, the coach, everyone needs to be cognizant of what these kids are going through. So it's important. Staying hydrated is probably the #1 thing.
Okay.
The kids don't need to be a hero. If it's too hot, you need to take breaks. Make sure, and then normal things that everybody needs to do. Make sure they're properly fueled, eating right, getting plenty of sleep, and rested for those, for those hot days.
Okay. Well, thank you so much, Dr. Reed. If you would like a Living for Burke screening for your child, you need to contact our Paul D. Cordes Outpatient Pavilion and ask for the Living for Burke screening. This is an out-of-pocket expense for parents. It's $150. It is not billed to insurance, so you can self-refer. And we'll have that information for you on the screen for you to reach the Outpatient Pavilion. So we want to thank Dr. Reed for being here, and we want you to stay with us because we're going to talk to Dr. Linda Kiefer next. She's a pediatrician with St. Tammany Pediatrics. We'll be right back.